Thank you, Mr. Chairman and members of the subcommittee. Thank you for having me here to discuss CMS's strong program integrity efforts to reduce waste, fraud, and abuse in the Medicare program. As the person directly responsible for overseeing Medicare's program integrity efforts at CMS for the past 6.5 years, I know firsthand the frustration you all feel with the pervasivity of healthcare fraud in the federal healthcare system, and concur that CMS needs to be ever vigilant and ever changing in its continued program integrity efforts. To that end, there are 3 areas where CMS has focused its program integrity efforts: provider enrollment, data analysis, and feet on the street. Provider enrollment has been and continues to be the most persistent challenge to CMS's program integrity efforts. As long as those with bad intent can obtain a Medicare billing number, the potential for fraudulent misconduct remains exceedingly high. In areas that CMS has identified as highly vulnerable to waste, fraud, and abuse, such as durable medical equipment and home health, increased oversight and implementation of additional safeguards are making a real difference. These standards have already shown success at keeping those with intent to defraud Medicare out of the program. During 2009, CMS put in place new enrollment safeguards such as accreditation, surety bonds, and stricter quality standards for Medicare DME suppliers. In part, these efforts may explain the nearly 15% drop in the number of suppliers enrolling in the program from last year's participation levels. Combined, these efforts have led to an overall reduction of 16,000 suppliers being removed from the Medicare program since January 2009, without any impact on beneficiary access to care. Data analysis is another area where the agency is better positioned than ever to use internal tools to assist us in proactively identifying potential fraud before it occurs. The development and implementation of the first phase of CMS's integrated data repository went live in January 2010. This allows CMS the ability for the first time to look across Medicare fee-for-service and Part D claims on a post-payment basis to see shifts and trends against payment types, service types, and geographic areas. Applying predictive analytics and other proactive data analysis tools to this paid claims information will greatly enhance CMS's program integrity efforts going forward. Finally, when possible abuse is identified through this data analysis, CMS is now able to take immediate action to remedy the situation. Through our partnership with law enforcement in the HEAT initiative and the presence of the CMS field offices in high fraud areas such as Miami, New York City, and Los Angeles, CMS is able to send people out to follow up immediately on instances of suspected fraud and thereby quickly take administrative or other appropriate action to stop any potential harm to the program. This feet-on-the-street approach has been hugely effective, particularly with respect to infusion therapy, which was particularly pervasive as a fraud problem in Florida. Our efforts in that area alone have resulted in over $485 million in savings to the program, 410 provider numbers being revoked, and over 53,000 beneficiaries being put on edits to stop improper claims being paid on their behalf in just a 2-year period of time. While the 3 efforts I have just described have helped CMS address many of its program vulnerabilities, there is much more that needs to be done. To that end, I would like to conclude by describing ways CMS is better positioned than ever to meet the agency's future needs and challenges. First, the coordination and collaboration with HHS, OIG, and DOJ through Project HEAT, begun in May 2009, represents a significant shift in the leveraging of resources across the various agencies involved in the fight against healthcare fraud, which will only enhance CMS's ongoing oversight efforts. Second, a realignment of CMS's internal organizational structure, which went into effect in April of this year, consolidates the Medicare and Medicaid program integrity efforts under a new CMS Center for Program Integrity. This new organization will position CMS to build upon and strengthen existing programs to combat fraud, while also allowing us to invest new resources and technology to reduce the instances of fraud, waste, and abuse before they occur. Lastly, passage of the Affordable Care Act builds on these efforts by providing CMS with important tools and in the ability to improve and streamline its program integrity capabilities, and allow us to have tools that will assist us with tailoring interventions to address problem areas. Enhanced screening requirements for providers and suppliers throughout Medicare, along with oversight controls such as payment caps and prepayment review of claims for high-risk services, will allow the agency to better focus its resources on addressing the areas of greatest concern. Healthcare fraud and improper payments undermine the integrity of our public and private health insurance programs. Taxpayer dollars have been stolen, fraud has driven up healthcare costs, and in a few cases, patients have been endangered. Reversing the problem will require a long-term sustainable approach that brings together government entities, our federal, state, and local law enforcement partners, and the private sector. The administration has made a firm commitment to reining in fraud and wasteful spending, and with the Affordable Care Act, CMS has more tools than ever to implement important and strategic changes. Thank you.